Our accident and emergency departments do an absolutely vital job, and they're seeing 1 million more patients today than they were 3 years ago. So they do face real challenges. Now, in the short term, we're going to help them with an extra £500 million over the next 2 years. But what we really need to do is get our hospitals working more closely with general practitioners, with GPs, and with social care departments to make sure we can treat more people more effectively in the community, as well as have them coming to A&E. That's what this is about: extra money, extra resources to help our hospitals and to make sure our NHS remains first class. It's a significant amount of money going into A&E departments over the next 2 years, and that will cope with some of the difficulties that we've seen. But alongside that money, we also need some changes in practice. We need to make sure there are more consultants and senior doctors available in our A&E departments. We need to make sure that GP surgeries work more closely with hospitals. We need to make sure that the frail elderly are better cared for in our communities rather than endlessly going in and out of accident and emergency departments. We need to take all of those steps alongside the resources that we're putting in. But this government is doing both those things, putting in the money and also making the changes so that all A&E departments can be as good as the one I'm standing in today. Here I am in a hospital here in Salford that hasn't seen problems in terms of its A&E department because it has been doing those things. It's been working with local GPs, it's been making sure that people who need urgent care get that urgent care, but it's also been making sure that people who need to see a GP instead see them and see them rapidly. So this can be done, and in the best hospitals it is being done. We've dealt with some of the really bad problems in our NHS, for instance mixed-sex accommodation, the mixed-sex wards, they've virtually been abolished. The rates of hospital-acquired infections are now at record lows. When I became Prime Minister, there were 18,000 people waiting over a year to start treatment. That figure is now down to about 400. So we've dealt with some of the real problems in our NHS, but there's always more work to do.